Hi guys, welcome to my channel. I have important discussion today regarding international students in Canada. It's for those international students that are bringing in pregnancy from their home country, that is pregnancy outside of Canada. If you are in this situation or you know someone, kindly forward this video to them. Let them know these facts. If you are coming to Canada and you are pregnant, you have to make proper plan for yourself and for medical service that you're going to receive coming in as international students. We have government insurance plan and we have private insurance plan. Government, they're free, of course. Then private one, of course, you have to pay for this service depending on their coverage. So the first thing you should do is know your school health insurance, know what it covers before coming in, and as at when it is effective, that is, the coverage will be effective immediately you arrive in Canada. So there are some provinces like my own. I'm in Nova Scotia, one of the Atlantic provinces in Canada. Getting government insurance, you have to be in Nova Scotia for 12 months before you could get a government health insurance. Health card, government health card for you to access the free medical care. So not until you spend this month, you're not eligible to get one. And there are some other provinces like that too, and there are some provinces that are different. So each province has their own eligibility criteria to themselves. So first thing first, go to your province websites. Look for their health services and know what it entails, know their criteria, know their eligibility, look for the coverage regarding pregnancy, labor and delivery. So then again, each school, the DL high school, have their own medical insurance for their students also. So find out before you leave your home country what it covers, as at when it's due, and all these necessary informations. Because if you bring in pregnancy that you don't have a proper plan for, and you think when you get here it will be that easy, I'm here to tell you that it is not that easy. In fact, it's so expensive that many pregnant women are having challenges going about. Some have to move to other provinces, some have to defer their admission, go to their home country to get the necessary medical care necessary for their pregnancy, antenatal medical service, and labor and delivery, even postpartum care. So it is very important. People are finding themselves in this difficult situation. So if you come to Canada from my own in my own province, like I said, you can only get government health insurance in Nova Scotia after 12 months of you staying in Canada, or after 12 months of arriving in Nova Scotia. Let's say it like that. And there are provinces that have the same criteria for their government health insurance, and there are other provinces that does have different criteria. So it's important that you know. Then again, generally, I know that if you are bringing in pregnancy from outside Canada, most of health insurance plan covers the pregnancy within 31 days old. If the pregnancy coming in outside the Canada is more than 31 days, like it's more than a month, they will not cover this. I'm talking about when you don't have if you don't qualify for the government health card yet, and you have to stay on the private insurance by yourself, or you want to get the insurance from the school, so they will cover if the pregnancy is at this within this period from day 1 to 31st day. If it is more than this day, they will not cover. And in Canada, childbirth from beginning to end is costing no more than $30,000 in here. It is so expensive that nobody wants to be in that situation. But for people that they were not aware, they find themselves in this situation, that's because they don't have alternative other than just do what it has to be. So there are some inconveniences getting getting delivery done. That is delivery. The delivery itself, other medical service, they are not free. You have to pay from your pocket. The free delivery can be done in some province like Saskatchewan and Ontario have the midwives that can deliver for people free of charge without charging anything. But midwife, they are licensed midwife, but they are not medical practitioners that they can do anything medical. So irrespective, you still pay the amount that is not cheap for you to do the necessary procedure, the blood work and all other scans they do during the pregnancy, and they are not anywhere cheap. So you have to know about this and make proper plan, because people will pay this money if you're not making right decision before you leave your home country. So you should know that. And another way to go about this is, if you know that it is your pregnancy is more than a month old, it is advisable you get your spousal work permits ready, and both of you should come in together so that you can depend on his own health card for you to get your medical services. So this will help. Also, if you are in this situation, you could wait for your husband. If you don't apply for the visa at the same time, it's better you wait for him to ready and he comes in to join you, so you can be under his own plan that can cover you and save yourself from these enormous amounts for the childbirth. So I think that is what I have to say today, and this is my first video, and I hope I disseminate proper information. And if there is any addition, anybody know, kindly comment down below and let me know what else I'm missing out. And I hope you subscribe, share and like my video. Let it be an encouragement for me so that I will be able to continue bringing in some important information across to you. Thank you so much.